on behalf of the Ministry Office, all the stakeholders and the organizers of this important event covering the World Antimicrobial Resistance Week to commemorate and also to ensure that we create more noise levels among the Sri Lankan population, medical fraternity and other stakeholders in relation to necessary action steps and possibly to develop a policy direction in relation to antimicrobial resistance and related issues. I've been made to understand it has been ongoing for the last couple of years' time, and you have plans with the support from the other stakeholders, including multilateral agencies, World Health Organization, and also Fleming Fund, to create more programs on futuristic basis. I take this opportunity also to thank Dr. Alaka Singh and the World Health Organization for its unwavering commitment to enhance the Sri Lankan health sector, covering this subject and many other subjects related to the Sri Lankan health sector. We know this has become a serious concern over a period of time. Annually, more than 700,000 lives are lost due to antimicrobial resistance. And in Sri Lanka, nearly 2,800 lives are lost, which is a significant number, which is passing grossly under-noted, I would say. We have different campaigns, anti-malarial campaigns, anti-filariasis campaign, anti-dengue campaign, so on and so forth. And we give a lot of prominence to some of the areas. It's important, I'm not undermining them. But we lost 75 lives last year due to dengue. We created a lot of noise levels, which is good. But as against dengue, we are losing nearly 3,000 lives per annum because of the antimicrobial resistance. Directly due to antimicrobial resistance, and indirectly another 5,000 lives are lost due to related cases. The number is coming up to 8,000 per annum, something significant and something we need to address acutely. So that's why these programs are launched and created. We understand, starting from the medical fraternity, the pharmacists, nurses, other stakeholders, and also the people at the ground level, given a lot of information by different mechanisms. I think we need to further strengthen such courses to ensure that we create more awareness, to ensure there's rational prescription, there are no haphazard use of antibiotics, and those antibiotics are preserved for well-deserving cases to ensure that we reduce antimicrobial resistance in the long run. Sri Lankan healthcare system had provided immense care to the Sri Lankan people since independence. Successive governments of the country have spent billions of rupees to ensure that Sri Lankan people live a decent, healthier lifestyle. Of course, the results of such investments are great to see. Some of the results have paved the way to create a very good, healthier society in the country, which is applauded by the World Health Organization also many a times as a country that provides better quality health care at affordable and lower costs. We need to further strengthen. Now, for the next year, there's a budgetary allocation of 410 billion Sri Lankan rupees, which seconds only to defense expenditure and also the expenditure for infrastructure and education. So this is given high priority over a period of time. But at the same time, we must ensure such capital and recurrent expenditure from the governments benefit the people at the grassroots level. I think we were kind of championing in relation to controlling maternal mortality, infant mortality, vaccine preventable diseases, and parallel to that, our life expectancy at birth has gone up to 77 years now. Mind you, it was mere 42 years at the time of we gained independence in 1948, not long ago, 75 years ago. Life expectancy at birth was mere 42 years. They've gone up to 76 or 77 now, and we can go further up, competing with the regional countries, at least to 80 to 81. I know 85 is the highest one recorded in Hong Kong, but we should be able to. We have the wherewithal, we have the mechanisms, we have the foundations laid to go to great heights in relation to healthcare system of the country, for which We need to have multi-sectoral approach, not only the health sector, the education sector is paramount important. Our maternal mortality rate came down because of the maternal education. With the education of the general public, we should be able to curtail and control some of the disease conditions, including non-communicable disease of the country, to a better level, for which something new, something people are not that aware is the antimicrobial resistance, and the health ministry and the other stakeholders should create more noise levels among the Sri Lankan population about the impact of irrational prescription and haphazard use of antibiotics. For that, whatever the assistance that you may require from the Ministry of Health, we are fully committed to provide that support. We have a new secretary, Dr. Palita Mahipala, lot of experience in the health sector, and is bringing in a lot of experience from the world arena as well. Dr. Azeem Guruvardhan is there to help. Never mind the minister, all the others are doctors, so we should be able to spearhead this campaign to ensure the Sri Lankan healthcare, the Sri Lankan people live a better and a decent life. So thank you very much and have a pleasant day ahead.